Patrick Hutzel from intensivecarehotline.com with another quick tip for families in intensive care. So today I have a question from Jessica, who says, "Hi Patrick, I would love some help or any information regarding a hospital trying to discharge my father from ICU while he's still on a ventilator with a tracheostomy from a TBI. TBI means traumatic brain injury. They want to move him to an LTAC facility, and I want to know what grounds I have to stop them." Thank you so much. Jessica, thank you so much for writing in and for asking this very important question. Just recently, we've helped at least 2 clients to move their loved ones from LTAC back to ICU with our consulting and advocacy. And the reason we succeeded there is simply that we looked at the medical records, we looked at the clinical situation and said, well, these are the reasons why this patient needs to go back to ICU, otherwise they're at risk of dying or risk of more health damages. But prevention is better than cure. Therefore, you are on the right track, Jessica, to keep your dad away from LTAC as much as possible. So what we've done over and over again is when we review medical records, once again, we're making the clinical argument and saying, well, this patient is on a ventilator with a trach, they shouldn't go to LTAC. Now, LTACs advertise that they are the experts in weaning patients off the ventilator and the trach. Well, unfortunately, I have to say they're anything but. Usually when patients go from ICU to LTAC, they deteriorate fast because they don't really have the skills, the knowledge, or the expertise to look after someone on a ventilator with a trach. And I know when you look at their websites, they will say, well, we're the experts. Well, like I said, we have literally families calling us that have loved ones in ICU and say, help us to get out of there. This is a nightmare. So on what grounds? If your dad is on a ventilator with a trach, that in and of itself is enough not to let him go to LTAC, right? Often when patients are in ICU, there are many, many other things happening simultaneously. And one of the reasons your dad could stay in LTAC is he still needs input from neurology or neurosurgeon with a TBI. He might need input from other specialists, such as a cardiologist, a hematologist, a nephrologist. Not that you mentioned that here, but once again, when someone is in ICU, there are dozens of things happening simultaneously, and dozens of things happen that that need to be considered and that need to be looked at. One of the many reasons we've used to keep patients in ICU rather than going to LTAC is, again, specialist input, cardiology, nephrology, hepatology, gastroenterology, neurology, you name them, right? Because you don't get that in LTAC. But other reasons we've used is, patients might need blood transfusions. They might still need inotropes or vasopressors, right? They might still need IV sedation or opiates, right? Other things we've used very, very successfully is not giving consent to a PEG tube, right? That's one of the easier things to do. Don't give consent to a PEG tube. Your loved one, almost 95% doesn't need a PEG tube, right? A nasogastric tube will do, right? But I've made other videos about that, why a PEG tube is not needed and a nasogastric tube is fine. Most LTACs cannot take patients without a PEG tube, right? So other arguments you can use, Jessica, is that your dad can't go because the hospital discharge policy, if you ask for the hospital discharge policy, it'll most likely say that no patient can be discharged or transferred to another facility without patient or patient consent. Given that your dad has a TBI, he probably can't make decisions for himself. So you as the next of kin or power of attorney would be doing that. So therefore, you can also make those decisions based on the hospital discharge policy. You should ask for that, by the way. And if they can't give it to you, if they make up some nonsense because they can't give it to you, you know what's in there anyway, because that means the hospital discharge policy will say that your loved one can't go because the hospital needs consent, right? Next, I will also send you, below this video, I will also send you a link to a legal document about the framework for hospital discharges. And once again, you will see that patient or family consent is needed. So that is my quick tip for today. You know, I have worked in critical care for nearly 25 years in 3 different countries, where I worked as a nurse manager for over 5 years. And I've been consulting and advocating for families in intensive care all over the world since 2013 here at intensivecarehotline.com. And I can say without any exaggeration that we have saved lives with our consulting and advocacy. And you can verify that on our testimonial section. You can verify it on our podcast section, where we have done some client interviews. And because of that, we want to help as many families in intensive care as possible. And, you know, this video here, the email is from October last year. I'm only getting to it now. That's how many emails we're getting. It's now April 2024, so it's nearly 6 months since I get to all emails, and I do these videos almost daily, as you can probably see. You know, if you're a subscriber of my YouTube channel, which you should be. And so, you know, we now have a membership for families of critically ill patients in intensive care that you can get, that you can become a member of, and you can get access to myself and my team 24 hours a day in the membership area and via email. And you can get access if you go to intensivecarehotline.com, click on the membership link, or go to intensivecaresupport.org directly. Once again, in the membership, you have access to me and my team, and we answer all questions intensive care related. You also have access to 21 exclusive videos and 21 exclusive ebooks, all written by myself for families of critically ill patients in intensive care, so that you can make informed decisions, have peace of mind, control, power, and influence, and making sure your loved one gets best care and treatment. I also offer one-on-one consulting and advocacy over the phone, Skype, Zoom, WhatsApp, whichever medium works best. I talk to you and your families directly. I talk to doctors and nurses directly. When I talk to doctors and nurses directly, once again, I ask all the questions that you haven't even considered asking, but must be asked when you have a loved one in intensive care, once again, so that you make informed decisions, have peace of mind, control, power, and influence. I also represent you in family meetings with intensive care teams. We also offer medical record reviews in real time, so that you can get a second opinion in real time. We also offer medical record reviews after intensive care if you have unanswered questions, if you need closure, or if you are suspecting medical negligence. And all of that you get at intensivecarehotline.com. Call us on one of the numbers on the top of our website, or send us an email to support@intensivecarehotline.com. And if you like my videos, subscribe to my YouTube channel for regular updates for families in intensive care. Click the like button, click the notification bell, share the video with your friends and families, comment below what you want to see next, what questions and insights you have. I also do a weekly YouTube live where I answer your questions live on the show. And you get notification once again if you're a YouTube subscriber here on my channel. Thanks for watching. This is Patrick Hutzel from intensivecarehotline.com, and I will talk to you in a few days. Take care for now.